In this PowerPoint, we will complete our discussion of opioids, keeping in mind the complexity of this classification. Looking at the term opioids, this is a general umbrella term that includes all forms in this classification: natural, semi-synthetic, fully synthetic, and endogenous forms. The term opiates is also widely used and is specifically attached to the natural and semi-synthetic forms, as they are derived at least partially from opium. The term opioids is used as an umbrella term as each form produces similar effects. These general effects include activation of the opioid receptors in the brain. There are three natural opioid receptors: mu, kappa, and delta, and they work to help us modulate pain, our response to pain, and some pleasure responses. To do this, these receptors interact with three types of neurotransmitters: enkephalins, endorphins, and dynorphins. Enkephalins are known for processing harmful stimuli, while endorphins and dynorphins act as pain relievers. In addition, endorphins are also involved with the natural pleasure response. When any opioid activates the brain's natural opioid system, this has a general impact of modulating pain and pleasure responses. A common effect in this classification is referred to as a biphasic response. This means that there is an initial pleasure and/or euphoric response, followed by a drowsy response often labeled as nodding. In addition to this effect, opioids act directly on the respiratory center, causing a slowdown in this area. This is one of the reasons why opioid overdose can be so dangerous. Taking a look at the medical uses of opioids, opioids have been utilized across cultures for thousands of years. Early medical and ritual use viewed opioids as miraculous in their healing potential. While there are a range of medical uses, several are emphasized. First, opioids are widely used for pain relief and the treatment of chronic pain. One of the reasons that they help to not only to diminish the sensation of pain, but also diminish a person's awareness of it. This has therapeutic benefit as pain can result in shock and anxiety, and opioids work to help a person remain calm as well as be in less pain. Second, opioids have routinely been used as a cough suppressant. Third, opioids have been effective in many regions of the world as a treatment for diarrhea and dysentery. Lastly, opioids are regularly implemented in palliative care and end-of-life care for not only pain, but issues such as air hunger, which is the feeling of not getting enough oxygen. Taking a closer look at the main form of opioids that help in these medical uses, we will start first with the natural types. There are three natural types which are derived from alkaloids in poppy plant. These three are morphine, which was discovered in 1806. This is the most potent of the three and is often considered to be the gold standard for pain relief. Next is codeine, which was discovered in 1832. And lastly, thebaine, the weakest of the three alkaloids, which was discovered in 1835. Looking more closely at morphine, after its discovery in 1806, use spread significantly due to two developments: the hypodermic syringe, which made it more available to physicians, and its regular use during the Civil War for treatment of pain, commonly referred to as soldier's disease. It is important to note that during that time, little about the addiction potential was known, which has become a common theme within this classification. However, as the addiction potential became known and acknowledged, this led to a search to find a way to harness the pain-relieving properties from the poppy plant while eliminating the habit-forming addiction potential. This effort is what has fueled the search and development of many of the following forms. Moving next to semi and synthetic opioids, the most known of the semi-synthetic form is generally heroin. Semi-synthetic means that one of the three natural alkaloids is used in the manufacturing process. Heroin has morphine with a combination of acetyl groups added. Its chemical name is diacetylmorphine and was given the brand name heroin by Bayer and placed on the market in 1898 as a non-habit-forming alternative to morphine. It was later discovered to be actually 3 times as potent as morphine. While the United States lists heroin diacetylmorphine as a Schedule I substance, other countries still have it available by prescription. Two common types of fully synthetic, meaning completely man-made, are Demerol, which was formulated in 1932, and methadone in 1939. Here again we see the quest to find a non-addictive opioid, as methadone was first believed to be a non-habit-forming alternative to morphine. It was generally prescribed as an alternative to those with a morphine allergy and has become known for its use in treating opioid dependence. Since its development, a more in-depth understanding of its uses as well as addiction potential is now understood. When discussing semi and synthetic forms, prescription narcotics fall under both of these categories. Listed on this slide are some examples of both semi-synthetic and fully synthetic. Lastly, many examples of designer drugs and new psychoactive substances discussed in emerging drug trends would be listed in these areas. Some examples would include crocodile, acetylfentanyl, and purple drink, also known as scissorup, lean, or dirty Sprite. As noted before, please keep in mind that many of these new trends are not actually new per se, as the active ingredient in crocodile has been around since the early 1900s, and purple drink has been widely used in other locations for decades. Looking at all forms of opioids, the short-term effects and risks can be as follows: a type of pain relief, pleasure, euphoric response, drowsiness, a reduced respiration rate, and clouding of mental functioning. Acute toxicity in the form of opioid overdose is both very dangerous and increasing in risk. The depression of respiration is what leads to death, and this effect of opioids are compounded when combined with alcohol. When addressing opioid overdose, we look for what is referred to as the opioid triad: coma, depressed respiration, and pinpoint pupils. In these circumstances, medical attention is imperative. The medication used to counteract an overdose is naloxone, or Narcan, and has been effectively used in saving many, many lives. Turning now to long-term effects, one of the most common risks and effects discussed is addiction potential. Opioids hold a high risk of addiction in both physical and psychological dependence areas. While the addiction potential is high, there does exist a pattern of using, known as chipping, where opioids are used irregularly and/or infrequently. However, this is an issue in the field that receives ongoing discussion and examination, as the risks of addiction potential for this classification are well known. Another potential long-term effect commonly identified is opioid-induced hyperalgesia. This is a condition that results in reduced pain threshold and increased pain sensitivity. Additionally, specific risks associated with injection use of opioids are infectious diseases, collapsed veins, and bacterial infections of blood vessels and heart valves. Lastly, much attention has been given to opioid withdrawal syndrome. What is currently known regarding this issue is that the withdrawal symptoms from opioids are often extremely horrible and often result in people relapsing due to not being able to withstand the withdrawal experience. What is also commonly understood about opioid withdrawal symptoms is that they are not considered to be life-threatening or lethal on their own. However, while it is believed that one cannot die from the withdrawal symptoms themselves, caution needs to be taken for those who are medically at risk or who have medical complications. In these situations, the experience of the withdrawal symptoms can be too distressing for the body and can result in serious life-threatening complications and consequences. However, again, this is when medical concerns and complications exist. The withdrawal symptoms alone are not currently considered to be lethal. A more detailed look at the withdrawal process is shown in this slide and in the text. This will provide you with a breakdown of the specific signs and symptoms that can occur, especially in the first 72 hours.